Good afternoon. I'm honored to be here. I have great fondness for this school, for the inspiring teachers and wonderful friends that I first met here, and for the history and significance of Sacred Heart education for young women all over the world. We've heard some amazing things about mission today, and I'd like to build on what we've learned by sharing some of my experiences in the work that I do. I work as a pediatrician. Could it be better? And could we change the focus? The obvious way to make a conversation better is to change the content. To say, I know what the problem is and I can fix it. But sometimes I can't say that. The less obvious way to make the conversation better is to change the focus using a palliative care framework. So, what is palliative care? Palliative care for children and families has 4 key components: listening deeply and being present. And I put these 2 things together because they involve not talking, and sometimes that can be difficult. It involves responding to a fellow human being with compassion. It involves bringing expertise to manage pain and other symptoms. And it involves offering guidance when questions are unthinkable and impossible to answer. Mission discovered. Now, for that story that I promised you. This is the story of Nora. Well, actually, 2 Noras. The first Nora is my grandmother, my mom's mom, for whom I am named. She was born in Ireland and came to the U.S. as a teenager. She met her husband, Michael, also an immigrant from Ireland, in Chicago. There they married and raised 4 children, my mom being the youngest. My grandmother was a woman of unwavering faith, gentle humor, with a touch of mischief, and abundant love. She left behind that legacy of love in her children, grandchildren, and great-grandchildren, along with some wonderful heritage recipes like Parker House rolls, soda bread, baking powder biscuits. We really like bread in my family. And the story of another Nora begins just a few years ago. She was born with a very rare genetic condition that caused an accelerated aging process in her organs and tissues, among other things. Nora was a small baby all her life, and when she was 6 months old, she had a surgery to place a feeding tube to help her gain weight. However, during that surgery, her family learned that she had another serious heart and lung condition that made her oxygen levels low and made her breathing difficult at times. So she went home with a feeding tube as well as oxygen and a medication that she had to receive 4 times a day. Nora was only home with her family about 10 days when she started having more difficulty breathing despite oxygen and medication. Her parents took her to their local hospital. Her pediatrician and the emergency department doctors at the local hospital called for a helicopter to transport Nora to the pediatric ICU. While Nora arrived in the ICU fairly quickly, her parents faced a long and frightening journey back to UVA. In the PICU, it became clear that her heart and lung condition was getting worse. The medication and oxygen weren't helping enough, and Nora was struggling to breathe. There weren't a lot of options that I could offer to fix the problem. My job at this point was to listen. As I listened, I learned about Nora's life, about her parents, her big sister Callie, her grandparents, and all the family and friends who loved her. I learned about her favorite way to hold a binky. She wouldn't suck on the binky, she just liked to hold it and run her tiny little fingers around the rim and around the ring. I learned about their farm over the mountain and her dad's poetry and her mom's prose. I also learned about her struggles to gain weight and how the tube feedings sometimes caused her discomfort. I learned that her parents were worried about tests and treatments that could cause discomfort, especially if those treatments offered little benefit for Nora. Over the next several days, we outlined priorities for Nora's care and adjusted treatments according to her clinical situation. Nora's mom, Janelle, wrote a terrific piece on their blog. Really, all the entries are wonderful, but this one paragraph reminds me so much of Nora, and I love to read it again and again. Janelle wrote, "The nurse who cared for her during a meeting we had today said she was very intent on being the one to turn the pages while she read her little board books. It is clear she wants to experience life, and Jason and I are committed to giving her a good chance at experiencing it to its fullest, whatever fullest means for her." A few days later, we had more conversations involving all the doctors and nurses who were helping to care for Nora. The content of these conversations was more discouraging. The treatment adjustments were no longer having the desired effect, and Nora was having more episodes of discomfort. Ultimately, we prioritized comfort and closeness, declining risky tests and uncomfortable treatments. 8 days after her helicopter ride to the hospital, Nora died. It was a peaceful passing on a very stormy night in June. Her dad, Jason, wrote later in a blog about grief, "She died of natural causes at 7 months of age. I'm not sure I have a frame of reference for that truth." Mission revealed. So, what did I learn from Nora and her family? So many things. Let's take Janelle's phrase, "whatever fullest means for her." That phrase is the essence of palliative care. But how do we look deeper to really understand whatever fullest means for her? We are changing the focus of the conversation. Rachel Naomi Remen is a physician who writes about healing as distinct from curing or fixing. Dr. Remen describes the process of generous listening as a key component of healing. This kind of listening involves being present to another person. It involves suspending analysis and judgment of what is being said. It involves being open to the truth that the speaker is offering. Of course, Dr. Remen reminds us that generous listening is valuable not only in medical conversations, in doctor-patient interactions, but in all aspects of human interactions. I find this kind of listening very challenging. As doctors, we are constantly analyzing every bit of what the patient is telling us. Our minds are engaged in pattern recognition at 1,000,000 miles an hour, choosing and refining and rejecting potential diagnoses and problems. Most of the time in the ICU, this is a very useful skill. But sometimes this is not the right kind of listening. Sometimes the situation calls for deep listening, generous listening, mindful listening. This kind of listening is the process that allows us to understand Janelle's phrase, "whatever fullest means for her." Now, let's take a moment to look at the idea of compassion. Like listening, it is one of the key components of palliative care. Roshi Joan Halifax teaches about compassion in many ways, through her writing, her speaking, her social action, her seminars, and retreats at the Upaya Center. There are so many aspects of compassion that she illustrates beautifully, but I find that 2 aspects are particularly relevant to pediatric palliative care. First, Roshi Joan identifies compassion as a force that recognizes suffering in another person, turns towards it, and attempts to transform that suffering. Second, Roshi Joan emphasizes that compassion is not attached to outcome. I find that these ideas are both expansive and intricate. And because her delineation of these ideas is so masterful, I will not attempt to paraphrase her teachings. Rather, I'd like to offer an illustration of compassion in a poem. This is a poem that Nora's dad, Jason, wrote after teaching, sharing, and participating in a pediatric palliative care conference that we had at UVA. The poem is entitled "Surf," and his dedication reads, "For those who care for dying children." Mine was a swamp I had to traverse. I am still wiping the mud from my eyes. But you do this every day, and then you have to go home and eat your dinner. It must come on you like waves, lapping, tumbling, crashing even, never resting. And so maybe you are one of the rocky ones, hardened against the breaking water, protecting your shape, preserving the mainland. Or are you the sandier shore? Do you allow the waves to change you? Here is something I believe about you. No matter how you bear the surf, there must be a place in you where a little water collects. I wonder, have you ever, when the tide is low, gone there and taken notice of how beautiful that pool can be? Perhaps sometime we could go walking together, exploring the crevices or scanning the sand, stooping to retrieve those curious and delicate treasures the waves have brought. Jason Myers Benner, October 29, 2008. I admire his generosity, his curiosity, his empathy in this poem. Jason identifies the possibility of suffering in another person and transforms it with his imagery and invitation. And this is an invitation that is not attached to outcome. There are no strings. It is a gift. Mission accepted. A few years ago, my mom's friend asked me, Noreen, how can you possibly do this? How can you take care of these sick babies and even kids on hospice? And my answer was, because I can. It is a privilege and a challenge and a gift to journey with children and families who are asking the unthinkable questions and changing the focus of the conversation. What can you do? What is your mission? And how do you know? Pediatric palliative care will most likely not be your mission, but deep listening, generous listening, presence, and compassion will guide you as you discover your mission. Witness its revelation with an open mind and an open heart, and accept your mission, whatever it may be. There are many professionals and patients, colleagues, teachers, and friends that have guided me in this work and offered me their wisdom with patience and kindness, and I am forever grateful. Thank you.